Health officials in the United States are warning the public about a deadly drug-resistant fungus spreading in care facilities across the country. According to a new study, screened cases of Candida auris tripled from 2020 to 2021. The US CDC is calling the fungus an urgent threat, in part due to its high death rate. Toni Waterman reports.
Just as Americans are putting COVID-19 in the rearview mirror, a new threat is emerging. Health officials are warning of a deadly fungus that has been spreading rapidly in hospitals and outpatient facilities across the country. According to the Centers for Disease Control and Prevention, cases of Candida auris have now been detected in at least 28 states, with the number of infections spiking again last year by nearly 50%.
First identified in
Dr. Megan Lyman from the CDC says the spread is more noticeable now, in part because of better screening and awareness.
We've also found that infection control practices are not perfect. I think that was true before COVID, but we saw that it got much worse during COVID because of the strain that public health, healthcare facilities had on them.
Besides its rapid spread, health officials are also concerned about the fungus's growing resistance to the medications usually prescribed to treat the infection.
I think it's like 90% of the strains that they've isolated are resistant at least to one of the antifungal drugs, and about 30% are resistant to 2 antifungal drugs. So, you're running out of options on how to actually treat these.
Dr. Philip Wong says this could be a symptom of the overuse of antibiotics through the years. At this point, the CDC says the general public shouldn't panic because healthy individuals aren't usually at risk of contracting the fungus, also known as C. auris.
C. auris really affects people who are very sick at baseline and require high acuity care. So these are patients who are on ventilators, have invasive medical devices like central lines, feeding tubes, urinary catheters.
But for those who do get sick, the outcome can be dire. C. auris can cause severe infections, with up to 60% of patients dying. Health experts say the best way to stop its spread is through simple hand washing, proper disinfectants, and screening.
Organisms that have a spore are always really hard to contain because the spore makes them a lot more resistant to a variety of things.
The highest number of cases have been found in Nevada, California, Florida, New York, and Texas. Candida auris was first identified in Japan in 2009 and has since been reported in more than 30 countries. But health officials say the number of infections could be much higher because of underreporting and a lack of testing capabilities in much of the world. Toni Waterman, CGTN, Austin, Texas.